Cadmium is a soft white metal used in welding and metal plating, battery and plastic industries. Cadmium exposure occurs from cigarette smoking, significant source ingestion of contaminated food or water, and drugs, dietary supplements. Poison may be occur from inhalation of cadmium dust or fumes. Kidneys are the main organ affected in a long-term exposure. It binds to sulfidyl group. Action is it binds to sulfidyl group, denaturing the proteins or inactivating the enzyme. Mitochondria are severely affected by this process, which may result in increasing susceptibility to oxidative stress. It also interferes with the calcium transport mechanism, leading to intracellular hypercalcemia and ultimately apoptosis. Absorption and metabolism. Cadmium 2 to 7% is absorbed through the GAT, and its absorption is enhanced when the diet is deficient in calcium, iron or protein. Absorption through the respiratory tract is more efficient, ranging from 15 to 50% of an inhaled dose. It binds to RBC, plasma albumin, and metallothionein, which is synthesized in the liver. Cadmium is initially detoxified in the liver through the formation of the metallothionein cadmium complex, which is slowly released from that organ. Signs and symptoms. Toxicity by inhalation is far greater than by ingestion. On inhalation, symptoms develop usually after 4 to 8 hours. They are influenza-like, similar to those seen in metal fume fever. It is characterized by sneezing, sore throat, written cough, nausea, excessive salivation, metallic taste, headache, cyanosis, cadmium blues. After a latent period of 24 to 36 hours, chemical pneumonitis develops, which is characterized by fever, dyspnea, bronchospasm, pleuritic chest pain, along with tachycardia, oliguria, and non-cardiogenic pulmonary edema. On ingestion, symptoms occur in 1 hour. These are increased salivation, nausea, vomiting, cramps in the abdomen, diarrhea, myalgia, collapse, and rarely death. Chronic exposure causes anosmia, yellowing of teeth, cadmium ring formation, emphysema, bone pain, fracture with osteomalacia. Iti disease is the most severe form, and chronic renal failure, hypercalciuria, proteinuria, azotemia. In males, it decreases the libido, fertility, and serum testosterone level, and in males, in females, function of ovary and development of oocyte may be inhibited. Hypertension and hypochromic anemia may be seen. Cadmium is said to be carcinogenic, and increased incidence of lung, prostate, pancreas, and bladder carcinoma has been reported. Fatal dose. Severe cadmium more than 100 mg. Symptoms are seen with serum cadmium more than 5 nanogram per deciliter. Urinary cadmium more than 100 nanomole per liter. Fatal period 5 to 7 days. Blood cadmium levels are a reflection of acute cadmium exposure. Urine level appear to provide a better measure of the chronic exposure. Urinary beta-2 microglobulin test is an indirect method of measuring cadmium exposure. Urinary beta-2 microglobulin. Blood cadmium is measured by atomic absorption spectrophotometry or plasma mass spectrometry. Cadmium level in hair and nail samples are often determined in chronic toxicity. Saliva analysis can be an excellent method for diagnosis. Means tolerable level of cadmium is less than 0.55 microgram per liter. Treatment. Avoid exposure. Oxygen and steroid may be given in case of inhalation of the fumes. Stomach is washed with tannin or egg albumin, and activated charcoal may be given. Sodium sulfate as a purgative is given. Succimer 10 mg per kilogram per dose 8 hourly may be given. Decreases the GAT absorption and improves survival without increasing cadmium burden in a target organ in case of acute poisoning and diet carbamate in chronic poisoning. Vitamin D is given for osteomalacia. Hemoperfusion and hemodialysis are not useful. Never therapy. Dithiocarbamate and tetramethylene dithiocarbamate enhances the urinary and biliary excretion of cadmium. New DMSA analog monoisomer DMSA has been found effective for lead, cadmium, mercury, and gallium arsenide overdose. Combination therapy of DMSA and dia-DMSA is administered and more effective than a single agent. A combination of DMSA and calcium trisodium diethylene triamine Pentacetate has been effectively used in acute toxicity. Antioxidants such as vitamin C and E have a protective effective against cadmium toxicity. Nanoparticle cadmium can be absorbed by aluminum hydroxide nanoparticle. Postmortem findings: GIT, mucosa membrane of the esophagus, stomach, and intestine are congested and inflamed. Lungs, pulmonary edema, and emphysema. There may be degeneration or loss of bronchial and bronchiolar epithelial cells. Heart and liver fatty degeneration. Kidneys, proximal tubular necrosis, interstitial nephritis in chronic cases. Brain congested. Medico-legal aspects: poisoning with cadmium is rare, but may occur as an industrial disease. Cadmium poisoning occurred in 1946 after the contamination of food and water by mining effluent Japan, resulting in outbreak of Itai Ouch disease, so termed as a cadmium-induced bone toxicity, led to painful bone fracture. In chronic exposure, cadmium is bound to intracellular metathionin, which greatly reduces toxicity. Any attempt to remove cadmium from this deposit risks redistributing cadmium to other organs, thus exacerbating toxicity, as is known to occur in ball therapy, exacerbate nephrotoxicity. Thank you.